Hello, my name is Casey May. I'm an assistant professor in pharmaceutical science at Binghamton University School of Pharmacy. Courses I teach is P1 Pharmacy, Pharmaceutics 1, and I also teach Pharmaceutical Calculation 2. So my main role is to introduce the student about the fundamental science about how to make dosage form and formulations such as tablet, capsules, and everything you see in the pharmacy. Yeah, how do I support international students? Very good questions. I think for international students coming to study in this country and the high intensity pharmacy programs, having the full support from the faculty is really important. So for students in my class, they have unlimited office hour by appointment. If they have any questions, they can always book after hours appointments to have an in-depth discussion with me regarding the curriculums. In addition to that, we pay extra attention to the student needs. We'll monitor their in-class performance and see do they need additional tutorial support from the school, and we will refer them to such service if needed. And during the exams, we also provide real-time, you could say, interpretation or explanation to the exam questions, if such is needed, if there's any confusion in language translation from that. I think all the faculties are fully aware, this initial language barrier is it's going to be there sooner or later. We are fully aware of that. We are very happy to help students understand the test and curriculum. I think for international students, the number one big factor for me, I think, is to you need to stay open in engaging with your classmates. Because this is New York. Our students come here from all over New York and other places. You have a very diverse student population. So international students shouldn't feel shy in fitting in. They should really embrace the culture of New York, which is openness, to make friends. Not just friends with the classmates and friends with the faculties. And through that process, that will help you to embrace the school and the culture and curriculum much better and much quicker. And I think that is also very important for international students, because that's how you find your support net, either within the classroom or outside of the classroom. Because you do study with the same cohort of students for 4 years. So getting to know them early on and make friends with everybody, I think that would definitely help international students. So I've been to quite a few pharmacy schools myself, and I think Binghamton University is unique in the way that you do have that kind of small school vibe that people know each other, but at the same time, you also maintain the famous school prestigious in rigor in curriculum designs and student support. I think that's very indicative from our student success. So coming to Binghamton here, you're not just joining a small school, but high quality school, small school with tight communities that we do care dearly about our students. I think I can say that very confidently for all our faculties. So I think that makes our school very unique. I think as a school, we understand that student success is the most important thing that we care. So as I mentioned earlier, that we have, when a student coming in, we try to probe the student class level very early on in the first or second week. We have a very rigorous system to evaluate student performance, and that we interfere very early through in the classroom, adjustment, and out of classroom extra tutorials. Because we know that if we help the student early on, we can ensure the student success in the long run. I think that culture is deeply embedded within the school. We have quite a few tutorial programs from the students or the faculty-led program to ensure that students are taken care of from day one when they enter the school. And I think the result pays off. We do have a pretty good residency matching rate, and as a young school, we are having the highest NAPLAX passing rate as well. So we're really proud of that, and I think that motivates the faculties to do more. Directly from my end, if you look at the pharmacy faculty profiles, half of the faculty, they are practicing pharmacists. The other half of faculties, they are PhDs. And a lot of them, including myself, we have industrial working experiences. For example, we do research, R&D department in the industry, not just myself. We have quite a few faculty has that. So the school has a good connection, not just with the clinical faculties in the clinical practice side. We also have a good amount of faculties with active connection with the industry partners. So in that regard, I think we, as a faculty, we can introduce that very well for the student. So I do have a very bright, talented Korean student who is one of the first undergrad students I took into my lab for research. Her name is Sunny. Hi, Sunny. Sunny was here at Binghamton University studying bachelor in biochemistry, was doing research in my lab, doing drug delivery research, and was doing really well. And after graduation, she graduated last May. She got a job offer as a research assistant at Cornell Medical School in the pharmacology department at Cornell Medical School in Manhattan. So in my experiences, Korean students are really talented. They are extremely hardworking, and they're goal-driven. At the same time, they tend to have very good interpersonal skills. They're blending with all the American students with no problems. They're very well liked by her teammates. So I have a very, very positive experience with mentoring Korean students. Get involved, get control. We have a lot of student societies at Binghamton. That is one of the, I would say, the quickest way and best way to get engaged with local communities, especially the student communities that will help you to adjust the new life you have in Binghamton.
Yes, my name is Professor Kenneth McCall. I'm a pharmacist, a clinical professor in the Department of Pharmacy Practice at Binghamton University School of Pharmacy and Pharmaceutical Sciences, and I also chair the department. So in our skills lab at the School of Pharmacy, we have high-fidelity mannequins which allow our students to practice contemporary pharmacy and to learn how medications are used in hospital settings and critical care settings before there are rotations. Our program is a 4-year professional degree program, and the first 3 years include the didactic, coursework, and simulation. Each semester, our students work in this skills lab. So every semester, they work in the skills lab. Many of those activities are interprofessional activities with medical students, nursing students, physical therapy students. And when they work on those teams together, they'll work on clinical cases in the high-fidelity simulation lab. Pharmacy students at Binghamton University have several opportunities to gain experiences with pharmacy industry. Those are career paths that graduates from our program have pursued every year. We have had 5 graduating classes. Every year we've had students go on to career opportunities within industry. They can seek out summer internships to work in an industry setting in the summer between their spring and fall semester. They can also set up rotations in the final year of the program, advanced pharmacy practice rotations in industry settings. And we require all of our students to complete a longitudinal research project. And many of the skills that they use in their research project are transferable to industry careers. My area of research where I work with students is on pharmacoepidemiology, which is the study of medication use in populations. So I use national data sets. These can be Medicare, Medicaid, FDA data sets. And we look at medication use nationally across the United States. And we look also for medication safety patterns or signals for rare but serious side effects. We require a research project for all of our students. And during that 2-year research project, they learn important skills such as, in the projects with me, they learn data science skills, analysis skills, medical writing, because I require them to write up a draft manuscript, but they also present their research. All students are required to present their research, so medical writing in terms of presenting a poster. So there's a lot of transferable skills within that project. So when they begin, the program is called our Capstone Research Program, and when they begin that program, they partner with a faculty member on a specific research project, and that's at the end of their second professional year and then going into the third professional year. We have several classes that they take which help to provide foundations for their research project, and those are foundational classes on statistics, on research design, and they also must complete CITI training, which is the ethical training to conduct research. And then they meet individually with the faculty member that is mentoring them on the project. So there are always specific steps that need to be completed for each faculty member's projects. Many of our students work upstairs on the 3rd and 4th floor with our faculty, in the labs doing bench research, drug discovery or analysis. And many students work with faculty on population health projects and also with faculty in the clinical research areas with hospitals and health systems around the area. Yes, that's a good question. So I've been a pharmacist for 29 years. So I can say, looking back 30 years, that the profession has changed considerably. Pharmacists today are essential members of the healthcare team and ensure the safe and appropriate use of medications and that patients are taking the optimal medication, especially for patients who have chronic complex diseases. Pharmacists on healthcare teams can help to optimize the choice of the medication that a patient is taking and make sure that it's the right dose given the individual patient needs, which can be things like age and kidney function and a lot of different parameters. So pharmacists today in 2025 are even more integrated on healthcare teams across all settings than they were 25 years ago. And as we go forward, pharmacists are going to be involved even more working closely with healthcare teams to individualize medication for patients. So I see that being more important. That's correct, yes. And working very closely on healthcare teams for direct patient care, but also for managed care in terms of managing resources to provide care, and then also in industry for drug discovery and bringing new breakthrough therapies to market. So our program starts with a strong foundation in pharmaceutical sciences. That's in areas such as pharmacology, pharmaceutics, pharmacokinetics, pharmacogenomics, but a strong foundation in pharmaceutical sciences is where our program really begins. And that's essential because if you think about how fast healthcare is evolving, how fast medicine has changed just within the past 10 to 20 years, you need that foundation to last an entire career in medicine, because the drugs that are the essential medicines used today are going to change in terms of breakthrough therapies in the future. So that foundation really provides the building blocks for the entire career as a healthcare professional with new biologics entering the market, new therapies entering the market. But then also our program has a 9-course series, which we call the Integrated Pharmacotherapy courses. And that's where our sciences and pharmacy practice faculty teach together through 9 courses that covers the modern use of medications for patient care. So the clinical aspect is integrated throughout the curriculum. So we have an early assurance program also. You know, folks can declare that they're interested in pharmacy, and we have the specific courses that they need to complete, and they can begin the pharmacy program as soon as 2 years of undergraduate education. Some of our students, however, have already completed an entire degree, so they've completed 4 years of undergrad education, but some students track right into the pharmacy program after completing the 2 years of required courses. So we have, we work with students on the main campus who are already pursuing pharmacy, and we help align the courses that they need to take in order to be eligible for admission into the program.
Do future Korean students recently study at the pharmacy school?
Yes. So, you know, our main campus has a strong history of training health sciences professions, including, you know, our biology departments, biochemistry departments, neurosciences departments. So, you know, I would say, having worked with students from our main campus who begin the pharmacy program, that they are very well trained for healthcare careers. And then here at the School of Pharmacy and Pharmaceutical Sciences, we train pharmacists who can work across many different career paths: community, hospital, long-term care or nursing home pharmacy, industry. We train our graduates to work across many different career paths for pharmacy, and they have opportunities after graduation to continue to specialize if they know that they have an interest in cardiovascular therapeutics or psychiatric therapeutics or infectious diseases medications. They can specialize in those areas as well.